Hey guys, welcome back to my channel. Thank you so much for tuning in. Today's video is about managing your time when you are on night shift. It's light out, but it's about to get dark, and I am taking trauma surgery call this weekend, and so the night shift can get really crazy, especially when you're on trauma surgery, because you never know what you're going to get. It could be a really busy night with trauma after trauma, and especially on the weekend during the summer days, those are the times that trauma surgery is the busiest. And so I'm going to go over strategies on how to manage your time, what I personally have found really helpful, and what I do to stay awake, stay energized, and stay calm during a otherwise really busy night shift. And so before we get started, don't forget to subscribe to my channel so that you know when I drop new videos. Follow me on Instagram at 15 Blades for daily posts. Like this video and comment below. Let me know what other content you want to see, and hopefully I'll keep creating more videos for you guys to enjoy. So let's get started. So one of the first things that I do when I'm starting a shift that I know is going to be really challenging is identify one spot in the hospital that I can go that's away from a lot of the beeping and the noise, wherever that might be. Even if it seems like there's no place like that in the entire hospital, you will find somewhere. One time I had a little bit of time and I just walked all over the place, and I came across this random little hallway that we have that is really meant to lead into a storage facility. It is not even a patient care area, which is much better because it's away from any monitors and beeping and the hustle and bustle of a hospital. And so I come out here when I need just a few minutes to decompress, and I just do some breathing exercises. It sounds silly, you guys, but when you're under a lot of pressure and stress and you need to perform at a high level, you really need to take care of your mental health. And as silly as it sounds, a moment of breathing exercise really resets your mind and gets you to be a little bit more focused. And I get this question all the time: how do you stay energized? How do you stay motivated? How do you stay focused? And it's all about your energy, it's all about your mentality, and you taking care of your mind. And so coming in here, taking a moment to breathe, no matter how busy you are, you will find a moment for yourself. And taking care of yourself means that you're able to take care of your patients. So it's not a selfish thing, it's actually selfless to be able to take care of yourself. So I come out here, I take a moment, I decompress, and I'm lucky because it's actually next to a bunch of windows, so I'll get a little bit of sunlight, even though sunset is in 30 minutes and it's gonna be pitch black here. So it's really my place that I found to just decompress, and that's something that I recommend. Identify that place when you're about to start your night shift and or even your day shift. It's going to serve you well. So one of the things that I always do is I use the stairwell when I am on night shift, and this is funny, but it actually gets your body moving, it gets your blood circulating, and it wakes you up. And so I never use the elevator when I'm on night shift. Even when I have to go up to the 7th floor, I always try to take the stairwell, unless it's some sort of emergency, but that's a little trick that I do. My other piece of advice, you guys, when you are on night shift is always stay hydrated. I always try to have a drink with me, something that's a little more exciting than water, because sometimes I really just don't feel like drinking water when it's a little bit cold in the hospital and it's super late. I like sipping on something, and so I will do a kombucha. Every now and then I will get desperate and have to grab a cup of coffee, which is not the most hydrating. So if you are drinking a lot of coffee, try to make sure that you're supplementing with other hydrating drinks, because that is definitely something that is really difficult to keep up with when you are on night shift. So try to eat when you can, drink when you can, and if you ever have any downtime on nights, try to just shut your eyes for a couple of minutes and allow yourself to de-stress. So that is definitely big advice that I can give you while on night shift. Okay, so I am going to go over the most important thing when you are on night shift, and that is your patient list. Most of you will be in residency programs that use an electronic medical record, and a lot of you will have access to your own patient list. And so for me, I will use a pretend patient list. Obviously, there's no real patients on here, but this is basically what it looks like. There's usually the patient's name, patient's age. There'll be a column probably for hospital problem, and then their room and random different columns. And so it really doesn't matter what the columns are as long as you have the information of the patient, like their name, their age, and their room number. That's usually the most important piece of information, because this paper essentially will be the paper that you carry with you, that you can organize all of your tasks on and use it to keep you efficient, keep you on top of your task, and make sure that you get everything done before the day team comes in the morning. And so I am going to pretend like I have 6 patients on my list. I have all of my patients here, and the first thing that I do is during sign out, when my patients are presented to me by the day team, this is when I do the most listening, note taking, and task creation. Those are all of the things that you have to do in order to get through night shift. And one of the things that gets me through night shift is having a handy dandy multicolored pen. I'll link this pen for you guys and other pens that I like as well. And believe it or not, this actually keeps me nice and organized. And so I use color to kind of guide me through the night. And what I will do is using black ink with the patient name, when I get sign out from the day team about the patient, I'll ask for a one-liner. So let's say John Smith was a fall, and the one-liner should be really brief, just tells you a little bit about the patient so you know what they're here for. A fall with, let's say, a subarachnoid hemorrhage, and that's basically that patient's one-liner. And so when I get sign out about this patient, I'll know that this patient is mainly here because of a brain bleed. The way they acquired that is with a fall, and I'll have their age and of course room number. And then in one of the columns, I'll put their past medical history, just so I can note anything pertinent. And this won't be an exhaustive list. Remember that you're on night shift, and so your task is to run the floor and keep a lot of the patients healthy and safe. Your task is not to go and solve all of their problems. That's kind of the day team's job. You're just keeping everyone safe, comfortable, and healthy, and triaging any acute issues. And so I don't want to sit there and write everything that happened to the patient, but anything that's pertinent. So for someone with a head bleed, I want to know that, if they have hypertension. I want to know if they're on anticoagulants. So maybe this person has AFib on home apixaban, and so I'll just write down that they were on anticoagulation at home. And I will always use shorthand because there's not a lot of space, and again, I just want very precise, like one-liners, things that I really need to know about the patient. And then let's say they have migraines. So when they have a headache, I'll have to differentiate between, whether this is because of their TBI or because of their migraine. So let's say this is the pertinent past medical history, and then I'll put right away, I'll put my tasks here, and this will be things that I need to get done at night. And so things that I need to get done at night, this is where my blue and my red coloring comes in. Let's say this person has some labs that are going to result at 8 p.m. So I need to follow up those labs. And so I'll say follow up PM labs, and that is a task that I have to get done. So it's in blue, but it's not an urgent time sensitive task. When I find out their labs, whether it's at 9 or 9:30 p.m., it's not going to make a huge difference. However, if this patient went to the operating room and I needed to do a post-op check, post-op checks always happen around 4 hours after the operation. So that is important. If I do the post-op check 2 hours late, I might miss something. So in red, because that's an important task that is time sensitive, I'll put post-op check at, let's say, 10 p.m. So that way, when I'm running down my list, I see that this task is in red and it needs to get done. And so that's how I organize my tasks. Let me do an example of just like another patient with something else. Let's say Britney Spears is here because in this case, again, I'm covering trauma surgery, so I'm going to think of all the different traumas and acute care issues. Let's say she is somebody who came in with abdominal pain. So I'm going to say abdominal pain, and she was found to have let's say she has a inflamed gallbladder with gallstones, and will be undergoing a laparoscopic cholecystectomy tomorrow. So she has abdominal pain, and I'm gonna say planned for OR tomorrow. So for her past medical history, she doesn't have much. She has a history of, let's say, fibroids. Okay, so not super relevant to what's going on here, but it is common, and I'm just going to keep it here because it's her only past medical history. Again, for her tasks, let's say there's a couple of things that need to happen for her because she is going to the OR. She is going to be NPO at midnight because most people who are going to the OR can't have anything to eat or drink after midnight. But notably for her, to keep an eye on her pain, we need to do serial abdominal exams, which is important. And she needs, importantly, she needs a COVID swab before the OR. So those are tasks that absolutely need to happen in order for her to go to the OR. And this task, the serial abdominal exam, is important for documentation to make sure that I saw her after she came up from the ED. So these are tasks that need to get done. And again, you'll see that when I go down my list, it's very easy, since everything is color coordinated, for me to know that, oh, I really need to do a 10 p.m. post-op check, a serial abdominal exam, and a COVID swab. And I often put times in case there are times that these things need to happen at. And for patients that don't have really anything going on, I'll say something like, just to keep myself organized, I'll say nothing to do, and I'll kind of highlight it. So when I quickly glance at this patient, I know that there's no tasks. Let's say that this patient, there's nothing to do overnight. That doesn't mean that I'm not going to go see them. Of course, I'm going to go see the patient, but I just know on quick glance that there's nothing to do for this patient. And then the other thing that I will actually use this for is to take notes during the night, so that when the day team comes in, I have a really good sign out and I remember everything. Do not trust your memory when you're on night shift, you guys. Sometimes things get really busy and you really can't trust your memory. So what you need to do is make sure that you know everything. So what I usually do is events, overnight, and then I will do tasks for day. So things that need to get done during the daytime, things that I need to make sure that the day team does that doesn't really happen at night. For example, calling a patient's pharmacy. So let's say that for John Smith's AFib, we have no idea what anticoagulation he's on, and so it's really important for us to call pharmacy in the morning and check on the type and the dose of anticoagulation that they're on. And then I'll talk about overnight events. And so notes that I will take, I'll say admitted to SICU, which is the intensive care unit. And that's important because that means we're pretty worried about this guy. So admitted to SICU, let's say, I'll say neurocritical care consulted, and they recommended Q1 hour neuro checks. So now when the D team comes in, I'll tell them, oh, John Smith came in as a trauma. He was a fall with a subarachnoid hemorrhage. He has a history of hypertension, AFib and anticoagulation, and migraines. Overnight, he was admitted to the SICU. We got a consult from neurocritical care, and they recommended Q1 hour neuro checks. For tasks today, he really needs his dose for his anticoagulation, and we also need to do a tertiary trauma exam. So those are all things that need to happen in the morning, and then I will also give them a sign out of anything that anything else about his plan. So that's it. That's how I keep my list handy. And I will fold this actually like this in threes, and there's a reason why I print it landscape instead of portrait, because I like the smaller size. It fits in my front pocket better, and when it's like this, I can easily see the patient's name, and then if I need to take extra notes, because obviously there's not a lot of space here, I just flip this side over here, and I'll take extra notes. I'll say, I don't know, next of kin is his daughter, call in AM, and then like I'll put his daughter's number, like 917000000, whatever. And so that way, I need like more space for that, and then I have it here for the patient. I'll even like make little lines so that I'm not, at all confused. And so that's kind of the way I do it, and I always have this in my pocket. You guys probably see little papers in my pocket all the time. It just like sticks right into my pocket. So this system really works for me. It keeps me nice and organized. That way I don't really miss anything, and I can make sure that my patients are safe. And if I get a page about a patient, I can just quickly look, see where Denzel Washington is, look at the room that he's in, quickly go to the room, evaluate him, and then take notes of the things that happen overnight and if anything needs to be done by the day team. So that's it. All right, you guys, that's it. I am all done with my night shift. I am running home so I can get some sleep. I'm so exhausted, but definitely was a good night. And again, much more manageable with a few tips and tricks that I shared with you during this video. I hope it was helpful. Please subscribe to my channel so that you are the first to know when I drop new videos. Comment below, and don't forget to follow me on Instagram at 15 Blades for daily posts like this and more, and I will see you guys next time. Have a great day. Bye.